Sometimes they don't, you know, a little lethargic, might want to just kind of sit in their bed the whole time. That's totally normal.
Okay.
They're not going to fight over the food, will they?
Well,
She would.
yeah. Sometimes she's a little spicy.
Oh, wow. Oh, wait, so she doesn't even feel that right now.
So a lot of times they won't feel it. Have you ever had acupuncture before?
No.
Okay. So some spots can be a little painful, and that's usually the places that they really, really need it. So, and as she continues to get more treatment, she might be a little bit more responsive to.
Yeah, 'cause she don't really have feeling.
Yeah.
Good thing. And then I'll put all of my points that I do too in your record, so that way whoever you're following up with will know like what points I used.
Yeah.
Okay.
Okay.
And what about like her back protruding?
Yeah, so some of that too is a little bit from like muscle loss.
You're okay.
Okay.
You're okay.
So I can also feel like she's got a little bit of malalignment there just from a chiropractic standpoint. Not much we can really do about that right now. Now,
Okay.
as she gets more treatment, she gets a little more comfortable, it might become less pronounced.
But it's not like the end of the world, or
No.
Do you guys need me to do anything?
No.
Make sure she's
She's
alive.
doing good.
She says, this is great.
Yeah, you felt that one?
I should flat you one. Sorry, I'm rude.
Let's just do her little calming point here.
And how often should she get in the water at home?
If you can do it like every other day, that would be great.
Okay. And what about our walks and runs? Should we keep doing that? Okay.
Yeah. So maybe on the days that you do the water, just kind of take it easier.
Okay.
Okay.
Walks. Just gotta do a couple points. Here, we'll just do water.
And are we a little bit on the later side coming to see you? Or is it a decent spot? Like, what do you feel
You're
about
in
that?
a good place. I mean, a lot of times I'll see patients even after they've had surgery, after
Okay.
they've tried to do surgical
And it
correction
didn't
and
work.
it didn't work. So, yeah. Let me just put a hand under this one.
And you usually have more success than the surgery.
So I would say, I don't know if I can fairly say that. I would say that I have success with almost all the patients that I see, whether
Well,
they
that's
had
what
surgery
that's what
or
I'm saying.
not.
If they had surgery,
Yeah.
because if the
Yeah.
surgery didn't work and you did something
Yes,
to work, then,
yes.
yeah, okay.
Usually people see me so they don't have to pay for surgery. That's
gotcha.
typically
Yeah.
why I see people. Because it's cheaper to do these treatments and less recovery time than going through a surgery.
She really likes me.
She's happy. Okay. Thinking.
And one other thing about the estimate, I know you were saying the consultation was the 150 because you're teaching us the exercises and stuff.
Yeah.
So on the other ones, when we come back for the follow up, what's the difference in the $10 that they had?
Oh, so if you mean the physiotherapy for 30 minutes? That's us doing like the land treadmill
Oh, okay.
exercises, things like that. Which you don't have to do that if you just
No,
want to
no,
get the
that would be-
electroacupuncture, then we can just do that.
No, that would be
whatever.
fine.
Okay.
Yeah. Oh, okay. So you're saying, okay, I got you. So that's optional.
Yeah, the
Gotcha.
physiotherapy.
Gotcha.
Because if you guys are doing like the treadmill, I mean the hydrotherapy and stuff at home, you know, I think that's gonna be big. That's gonna be helpful.
So long as we come and get the acupuncture.
Yeah.
And then some weeks maybe we can just add it in if
Yeah,
we.
yeah, of course,
Gotcha. All right, makes sense.
Just lift her up one more time.
up we go.
I just gotta get to here.
Oh, I think one came out.
That's okay. She might drop a few needles too. I'm sorry, Meg. Knock you out. Okay, I'm also gonna put a couple points near her butt. So I know it looks weird, but the point of that is to help with some fecal continence. So we're trying to help stimulate the nerves.
I'm making you pee. Sorry, y'all should be on the bed. They'll probably wash beds.
Yeah.
Got to.
Thank you.
Our water bill is crazy.
I'm sure.
Oh, honey, I'm sorry. I'm pressing on you.
Okay.
Oh my
All right.
Oh, yeah, that's the fun one.
All right.
Got all your wires laid here.
No, don't eat any of these needles,
Here,
lady.
ma'am.
You're gonna have to keep her tongue busy. Okay. And I'll write like a laser protocol just in case your mom's able to get you guys a laser. You guys can. We'll probably have to have a doctor oversee it, but at least,
I don't think she has a laser at her location, but I'll definitely see if she can do something.
Is when you say laser, is that the same as like red light therapy, or those are different?
Different. So
Okay.
red light therapy is a pretty superficial treatment. The the companion lasers or the more medical grade lasers are class 4 lasers. So you have to wear eye protection, that kind of stuff, and it just penetrates a lot deeper. So it's much more effective.
And so I do see you have the laser on the treatment plan. How important is the laser?
I would say they all do kind of their own thing. So this is a lot for neuro kind of regeneration and kind of helping with the neurological components of her condition. Laser therapy helps to promote blood flow and reduce inflammation, also help with discomfort and pain. I would say primarily if we had to pick one, the electroacupuncture and the hydrotherapy at home.
Okay.
Those are probably the two most important.
And so also with that, like, is it pointless if we got red light, the laser therapy once and we didn't get it again for 3-4 weeks? Is that pointless, or if we're gonna do it, we have to do it?
I think that's a good question. I think that it doesn't have to be as frequent, but I think that probably it's not a one and done thing.
Gotcha.
Because it's not an acute injury. If we have a dog that's out and they pulled a muscle or something, sometimes that's a one and done.
Gotcha.
Yeah.
Gotcha.
What's that?
What x-rays did you want for makeup?
3D like pen hip. So VD and lateral on each side. Yeah, and then get stifles in there too.
Oh.
Yeah. Okay.
Alright, get ready for action.
So sometimes they're a little reactive at first. Sometimes they don't feel really anything.
I feel so bad I didn't bring
Okay, so this is gonna go for about 15 minutes. What
Okay.
questions do you guys have?
What about you?
Anything?
I mean, I kind of been asking a lot through it out.
No,
So,
that's good.
yeah, I mean, so like you said, you think the most important thing is the acupuncture and hydrotherapy.
Electroacupuncture, and then you guys doing the exercises at home.
Okay.
Mm-hmm. Yeah.
And so, what if
And the
someone's
herb.
in a the herb?
Yeah.
Okay. What if someone in Atlanta does acupuncture but they don't do electroacupuncture? That's pointless.
I would be surprised if they don't do electroacupuncture.
Okay.
Most of us either train either with IVAC or the Chi Institute.
Okay.
So, I mean, this is pretty. If you do
Standard.
acupuncture, you should know how to do electroacupuncture. I would be surprised if they didn't.
Okay.
If not, I would still just do the acupuncture.
Okay.
I think that alone.
I mean, at
really
that point,
helps.
I'll probably, like I said, I don't have a problem driving here once a week.
Okay. Okay.
And so you're saying if we do come once a week, it'll just be $100 for the acupuncture.
For the acupuncture.
Okay,
Yeah.
right.
Yeah. Unless like you have to add something in, like we all have
Yeah.
some have diarrhea or whatever. But when you do the follow-up treatments, we try to make it faster so you guys are in and out of here. And we just have you just call us ahead of time if there's
Okay.
like a different issue we have to address or there's something else you want to change the medical plan and it takes more time.
Okay.
Then we just say call ahead of time because my schedule is stacked.
Okay.
So we just need a little kind of time to adjust.
Gotcha. Understood.
Yeah. Yeah. Sound good?
Yeah.
All right. We're gonna go ahead and get all those meds together, and then you guys are gonna follow with your clinic on getting the antibiotics and all that
Yes.
other stuff.
Yeah,
right?
the antibiotics and
Culture.
the culture.
Okay, yeah, you can do the
So-
yeah, that's true.
so
You'll
we
probably
will
get a
get
better
the,
discount there. And then we'll put the notes in our chart about what we had, so that way they know.
And I'm holding
this
that
is
urine that we got in the sterile cup just in case.
Sure,
They
okay.
can't like
Yeah.
culture or
sounds
something
good.
like that.
They should be.
Yeah, that I'm pretty sure they do.
Just in case. We'd hate it if we didn't.
Yes. Yeah.
The one time I throw it away, it's gonna be
Yeah.
the one time.
Right.
She needs it.
But
How about
I
this?
mean, you guys have done a lot for her, and I think that thank you for everything you're doing. And
Thank you.
But you do. I mean, I know you can't say, what will
Yeah.
happen, but you do think it is a possibility.
for her to be mobile again.
Yeah.
I do. I mean, based on like most of the cases we get, I mean, I've had cases that are worse than her. I have Otis. He's a Frenchie, and all he does is like he's like a mermaid. Like he just
Aw.
all he can do is like wiggle his hips, and he's like can't even stand on his
Aw.
forelimbs, and now he runs.
Did this
Yeah.
part come off?
Yes, it did. And now he runs. So like, and that's.
I was thinking
like,
that. I told him about Pete.
Oh yeah, Pete. I mean, we've just got a lot of really good
It's
case
current.
results.
Okay.
Petey pie.
So, but yeah, I mean, this is 50% of my caseload is mobility stuff like this. So,
Okay.
Okay.
if not, then he gets to go documented into my list of failures, which would be awful, and I don't want that. So that's why I do what I do. But yeah, anything else you can think of? Okay, so I'm gonna go ahead. I've got a couple more appointments I gotta do, and then once he's done, then I'll come back and I'll show you how to do the hydrotherapy. Okay.
Okay. Thank you. Oh.
Sorry, Speedy.
Alright, pretty girl. You stay right there. Don't you move. Do you feel like you guys are comfortable watching her?
Yeah.
And I can step out and fill your meds. And then I am setting a timer, so I'll be checking on you.